Hey guys, today I'm going to talk a little bit about SAD or seasonal affective disorder. Now, this is something that takes place during the winter months. So it's also called winter depression, aka. And it's a time of the year, like right now, where the summer is winding down and we're getting ready to get into the fall season and then winter. And with decreased daylight, decreased sunlight, this affects a lot of people's moods throughout this entire season. SAD can also be seen in the summer months, but it's less likely. It's usually in those months of the year, again, where there is less daylight. So, what happens here is that with less daylight, we have a decrease in our hormones, serotonin, and that is the hormone that affects mood and our well-being. So that decreases during this time of the year. And also we get an increase in our melatonin. And if we know anything about melatonin, we know this is the drug that we have in our sleeping aids, our sleeping pills. They have melatonin in there to help us wind down. So with an overproduction of melatonin during this particular season, it tends to make us sleepy. It tends to make us more lethargic. It tends to make us want to just curl up. And of course, it's cold out, right? So it makes us want to stay in longer. It makes us want to sleep more. And it just makes us really lethargic during this season. So if you see someone sleeping away during the winter months, just know that it could be SAD. It could be a response to what their hormones are doing during this time of the year. So some common symptoms again would be persistent low mood, irritability, hypersomnia, meaning that you're sleeping away too much, low energy, feeling fatigue, withdrawal from social activities. Again, it's colder out during these times of the month. So all of this, again, that serotonin, which affects our mood and our overall well-being is greatly affected during this season. So those who are mainly at risk are those who may already have symptoms of depression or bipolar. It may also be if you have a history of depression, let's say, in your family, and very not necessarily rare, but there are few occasions where we have just regular individuals without a mental health diagnosis that will experience SAD. And some of us just experience it just naturally again when the season changes and when it starts getting darker earlier, we might notice a little change in our overall perception of the day due to this, not necessarily having a diagnosis but just noticing that that's in our well-being that we also can be affected by seasonal affective disorder. So just some quick things that you can do to help yourself, and that would be being out again as much as you can in daylight. Okay, staying socially connected and preventing isolation, making sure that you're taking your vitamin D supplements. Vitamin D is amazing for all different functions in our body, and making sure that we take regular vitamins, of course. Please consult your physician before doing any of this, of course, and that should help regulate as well some of the hormones. And of course, if you feel like it's something that is overtaking you, of course, speak to a therapist, speak to a mental health professional. So again, just a quick overview of SAD. And one more thing, of course, exercising. I always forget exercising can be one of those things, again, that helps to pretty much counter just about any mental health issues that we're having. And we know that that will help with those feel-good hormones as well when we exercise. So if you feel like this is something that is affecting you, please seek help. Please talk to your doctor. Please seek out a mental health professional and get the help that you need. Again, just a quick overview of seasonal affective disorder. Hope that was informative for you, and I'll see you in the next video. Take care.